Hi there, welcome back. So when you go to the doctor and they ask you questions about your family health history, do you always know the answer? Like, or are you like me and you're like, oh, I don't know, I have to call my mom. For most of us, we probably don't know our extensive family health history, and there's a lot of things we really do need, but Thanksgiving apparently may be the perfect time to actually ask questions. In fact, the U.S. Surgeon General has actually declared Thanksgiving the National Family Health History Day, since it's a time where a lot of us gather with our family and close members and everybody's there. And you know, you got to make lots of conversation. So this morning, Dr. Scott Itano, who is a family medicine physician with Kaiser Permanente, is here this morning. So let's talk about health history. Why is knowing your family health history so important?
Well, thank you so much for having me here. When I think about someone's health, there's two components, nature and nurture. Nature is your DNA, genetics, and your family's medical history. On the other hand, we've got nurture, which is the environment you live in and how you live your life, what you eat and how you exercise. And those two components make up your health. A perfect example of this is if I've got a 25-year-old male patient who's a marathoner, someone who you think is the picture of health. If they've got a family history where all the men in their family have died from heart disease in their 40s, I'm going to screen him earlier for heart attacks, whereas normally I wouldn't.
And he's got to know that that family history exists to tell you to screen for him. So let's talk about how to start that conversation at Thanksgiving. Hey, Aunt Ethel, pass the mashed potatoes, and how's your heart?
Right. Not an obvious segue, but it's really just important to have the conversation in the first place. Most people don't know how to do this and think there's a stigma attached to talking about health conditions or things along those lines. You just want to open the conversation up and then go from there. And practice makes perfect. And then if you don't know how to do it, just throw your doctor under the bus. You know,
yes.
Say you're doing it for me and say your doctor needs this information or you need it for your child's health.
What are some key questions that I should definitely make sure I get some answers to?
That's a really good question. So you can start off broad and ask your family members if they've got any chronic conditions or why they go see the doctor, and then jump into specific topics. So then you can ask about things like cancer, heart disease, strokes, diabetes, or high blood pressure. You also want to know about your family members and how they passed away and what did they pass away from. And then lastly, what's the ethnic background of all your family members? Because certain diseases have a higher prevalence in certain ethnic communities.
That makes a lot of sense to me. Now, what if I can't know my family's genetic history or my family history? It's just not something I can uncover.
You bet. I have this all the time. Many of my patients, like yourself, may not know their family history, and that's all right, or they don't have access to it. And in that situation, I just want you to tell me that so I can take it into consideration when thinking about your health.
What if someone discloses something over Thanksgiving, maybe like a cancer diagnosis or something like that? I mean, that's probably a conversation that you're like, oh, I want to support you or I want to help you, but what do you do when someone discloses something like that?
Right. If you ever hear about something serious, like cancer or heart attack, or anything that just makes you anxious or worried, chat with your doctor, and that's what we're here for. And I want to make sure that we put your worries at ease and you don't have to worry about it.
Awesome, great information. Thank you very much. And there's lots of information as well online. Dr. Itano, thank you very much for being here. You can visit cdc.gov/genomics to learn much more about this. Thanks for being here.